Barchaga assalomu alaykum. Siz Dengiz TV kanalini tomosha qilmoqdasiz. Bugun yana biz Hindustondamiz. Esingizda bo'lsa, bundan oldingi videomizda jigar serozi haqida to'liq video chiqaruvdik. Mana bu tepadagi havola orqali yoki opisiyaga yozib qo'yganmiz. Bemalol kirib ko'rishingiz mumkin. Bugun esa Doktor, yaxshimisiz? Assalomu alaykum. Hello. Bosh miya, o'sha boshdagi kasalliklar, umurtqa hamda suyak kasalligi bo'yicha mutaxassis.
Umurtqa bo'lganida o'simta bo'lgan kasallar yoki notartib yoki deformati, ya'ni noto'g'ri chala tug'ilgan, misol uchun Parkinson, distoniya, epilepsiya
7000 industry.
7000da operatsiya qilganmiz.
O'sha joyda analizlarni topshirib sizga jo'natib olsa ko'rib aytish mumkin bo'ladimi yoki bu yoqqa kelib turib bu yoqqa analizlar topshirib keyin qanaqadir tashxis qo'yilishi mumkin? Mana shu kasallik uchun qancha summa ketadi hamda Hindistonda qancha muddat qolish kerak bo'ladi? Qanaqa meditsina rivojlanib ketdi? Sizda boshqa nimalar qo'yilgan? Xudo xolasa mana hozir men Dehli shahrining Max klinikasida turibman. Doktor, yaxshimisiz? Assalomu alaykum. Hello. Yaxshimisiz?
Welcome to Max Vaishalida.
Rahmat. Do'stlar, bu doktorimiz Doktor Xritikesh, neyroxirurg, bosh miya, o'sha boshdagi kasalliklar, umurtqa hamda suyak kasalligi bo'yicha mutaxassis. Xudo xolasa hozir sizlar bilan birgalikda hamma qiziqtirgan savollarimizni beramiz.
Thank you very much. Welcome. I have been to Uzbekistan and I love the people, place and the food very much. I have been twice there and we like it very much.
Konsultatsiyaga odamlar, ovqat, juda ko'p menga dedi.
Xudo xolasa yana borsangiz yana mehmon qilamiz, chiroyli qilib.
Thanks.
Doktor, hozir bizda shunaqa savollar, misol uchun yaqinda o'sha olib kelgan gulnamosinni qizimizdan ham misol qilib olishimiz mumkin. Mana shunaqa bemorlar bo'lsa, mana shu beli bilan muammo bo'ladigan bo'lsa, o'sha kasalliklarni tushuntiring aka o'zingiz. Qanaqa kasalliklar bo'ladi?
Actually, he wants to know that which type of patient you are treating and especially what is your interesting areas.
Okay.
Ular qaysi payt murojaat qilgani yaxshi hamda rezultat qaysi payt yaxshi bo'lishi mumkin?
And he wants to know one more thing, that in neurosurgery patients, most of the patients they got some accidental case or some neurological problems. So when they have to reach you out, that they will get the best result.
Okay. Yeah. I am Rishikesh Chakrabarty.
Isma Rishikesh Chakrabarty doctor.
I have a experience of neurosurgery in 16 years in neurosurgery.
On all the illik tajribasi bor ekan, neyroxirurgga bo'limda.
And I do surgery of the brain as well as the spine. The brain and the spine.
Umurtqa bo'lganasa va miya, bosh miyaniki asosisi operatsiya qilamiz.
Some of the brain surgeries like brain tumor surgeries. Okay. And in spine surgery like discectomy, spinal fusion, then sciatica pain. We do all type of surgeries.
Umurtqa bo'yicha nima bugungacha operatsiya mavjud bo'lgan bo'lsa, hamma operatsiyani biz qilamiz. Misol uchun umurtqa bo'lganida o'simta bo'lgan kasallar yoki notartib yoki deformati, ya'ni noto'g'ri chala tug'ilgan umurtqada muammo bor, shunaqa kasallarniki ham operatsiyani, har bitta turdagi operatsiyani neyroxirurgiya bo'yicha biz qilamiz.
But recently we are more doing the functional neurosurgery cases. The functional neurosurgery cases like Parkinson's disease, then movement disorders, dystonia, then epilepsy surgery, then vagal nerve stimulation, then your baclofen pump, spinal cord stimulation. This type of surgeries we are doing more. And for that we have some specific groups. We are a group of 6 neurosurgeons, but we are
komandasida oltita neyroxirurg jarroh bor ekan. Hammasi bitta komandasiga operatsiya qatnashar ekan. Asosiysi hozir yaqinda boshlagan ko'pchilik operatsiyalar qilamiz debdi. Misol uchun Parkinson, distoniya, epilepsiya, noto'g'ri tug'ilgan, misol uchun tomirda muammo bo'lgan, shu sababdan oyoq yoki qo'l qish bo'lib ketgan shunaqa kasallarga operatsiya biz doimiy qilamiz va shunaqa kasallarga, ko'pchilik kasallarga to'liq narkoz bermasdan, ya'ni operatsiya paytida kasal bilan gaplashib turib operatsiya qilar ekan.
O'sha bizga ham hozirgi kunda o'sha Parkinson bilan epilepsiya bo'yicha juda ham ko'p murojaat bo'ladi. O'shalar bemalol jo'natsam, demak anaqa davosi bor inshaalloh.
So he wants to know that nowadays lots of patients they are calling him for epilepsy treatment and Parkinson treatment. So what is the best possibility in this case when the patient will come to India for treatment?
See, for Parkinson's, first you have to diagnose it properly, that it is a Parkinson's syndrome, not Parkinson plus. There are many other conditions which may mimic as a Parkinson, but first you have to diagnose it properly.
Parkinson kasalnige ne davası bor ekan, lekin anik Parkinson borligini bilishimiz shart deyapti. Buni bilmasdan uni operatsiya qilsa natija bermaydi. Anik Parkinson diagnose qo'yamiz. Parkinson chiqsa uni operatsiya qilsa tuzalib ketadi, xudo xohlasa.
Epilepsiya.
What about epilepsy?
Then in epilepsy, first after the diagnosis, we have to give him best medical treatment. In the best medical treatment, I mean to say that we have to give the maximum doses of up to 3 anti-epileptic drugs. After that also, if the epilepsy is not controlled, then that patient can be subjected to surgery. Evaluation for surgery.
Epilepsiya kasallar uchun birinchi dori darmonlardan uni tuzash uchun harakat qilamiz. Eng baland dozasi bilan taxminan 3 ta epilepsiya qarshi dorilar berishimiz kerak. Agar undan ham umuman foyda bermasa, keyin epilepsiya uchun operatsiya qilish kerak.
Hozirgacha mana shunaqa kasalliklar bo'yicha asosan neyroxirurgiya yo'nalishida kasalliklar bo'yicha nechta operatsiya qilingan hamda hozirgi tepada tilga olingan Parkinson, epilepsiya kasalliklari bo'yicha nechta qilingan va sog'ayish darajasi necha foizga oladigan bo'lsak o'rtacha. Keyin mana shu soha bo'yicha qanaqa yangiliklar bor sizlarda?
Sir, actually he wants to know that's what is the number of patients which you are operated, especially for the spine surgery, brain tumor or Parkinson, and what is the success rate of the patients?
As a whole, we have done almost 7,000 surgeries in last 7 years total. 7,000 in last 7 years.
Yettiming the operation qilganmiz there.
Total, both brain as well as spine.
Umurtka, boshmiya, Parkinson, yettiming the operation qilganmiz.
There you can say 50% spine surgery, 50% brain surgery. Means
taxminan on 50% misol uchun umurtqa soha bo'yicha desiz bo'ladi, 50% boshmiya, ya'ni Parkinson, distoniya, epilepsiya, boshda o'simta bo'ladi. Shu hammasi boshmiyaniki kasal.
Do'stlar, shu o'rinda eslatib o'tmoqchiman. Siz Hindistonga jigar ko'chirish, oq qon, ya'ni ilik ko'chirish, onkologiya, buyrak ko'chirish, neyroxirurgiya va boshqa kasalliklar bo'yicha davolanish uchun bormoqchi bo'lsangiz, bemalol pastdagi raqamlarga Telegram orqali murojaat qilishingiz mumkin. Xalqimizga xizmat qilishdan xursandmiz.
And regarding this functional surgeries like Parkinson, this DBS, deep brain stimulation surgeries, we have done almost 50 to 60. And in that movement disorders again 60 to 65.
Dan 60 Parkinson kasalga operatsiya qilganmiz. Buni operatsiya nomi DBS ekan. Deep brain stimulation. To'liq nomini ekan. Shu operatsiyani 50 dan 60 ta operatsiya bo'lgan ekan va alhamdulillah yaxshi ekan.
Misol uchun Aziyadagi bemorlar o'sha joyda analizlarni topshirib sizga jo'natib yuborsa ko'rib aytish kerak mumkin bo'ladimi yoki ular bu yoqqa kelib turib bu yoqqa analizlar topshirib keyin aniq qanaqadir tashxis qo'yilishi mumkinmi?
Sir, actually wants to know the patient from different countries, they can send the reports to you, and by seeing that reports you can finalize the diagnosis, or may she needs to come to India for an evaluation.
See, the success of this surgery relies on the proper diagnosis. So sometimes only the report may not be sufficient. We have to see the patient, we have to evaluate him. We may have to do video EEG, we have to do other parameters, neurological examination. Then only we can say in a final way what are the success rate.
Asosiysi Parkinson kasalligi uchun aytyapti, faqat O'zbekistondan yo qaysidir yurtidan bo'lsa ham u yerda MRT yo analizlar topshirganini tashlab bersa 100% uni ko'rib Parkinson kasalligi borligini ayta olmaymiz. Sababi chunki uning uchun video EEG kerak, uning uchun qon analiz bor, MRT bor. Bundan tashqari o'zi kasalniki holat qanaqa ekan, qachondan boshlagan, qanaqa dori ichdi, qanaqa foyda berdi, qanaqa doridan foyda bermayapti, necha yildan bermayapti. Har bitta narsani uni operatsiya muvaffaqiyatli o'tkazish uchun juda ham katta rol o'ynar ekan.
As it is a bit high cost surgery, so we cannot
let Parkinson kasali operatsiya ozgina qimmatroq bo'lar ekan, neyroxirurgiya boshqa operatsiyalardan nisbatan. Shuning uchun albatta hamma narsani birinchi diagnoz 100% aniq qilib foyda beradimi, undan keyin bu operatsiyani qilish kerak.
Bitta odam beli singan, beldan pasti ishlamay qoldi. oradan 15 yil o'tgan. O'shani davolash mumkinmi yoki davolash darajasi tuzalib ketishi darajasi necha foiz? Tuzalmasligi necha
Actually,
foiz?
I have one patient who got accident before 15 years ago.
Okay.
And he got some treatment in her native country, and nowadays her legs are not working properly, her hands are not working properly. So for this type of case, is there any treatment?
Yeah. See, if the spinal cord is transected completely, we cannot repair that. There is no treatment for that, but for the symptoms, there will be spasticity, there is tightness of the limbs. For that, we can offer him treatment in terms of sometimes Botox injection, sometimes surgery of the spasticity. We can release the head, then there will be some less pain, or we can implant some spinal cord stimulator or baclofen pump. These are the treatment.
Savol bergandik, bunaqa kasalda asosiysi umurtkada, hamma umurtkani kontrol qiladigan orqa miya bo'lar ekan. Agar orqa miyada muammo bo'lgan bo'lsa, tomirlar qurib ketgan bo'lsa, u kasalga yana qaytadan xuddi yaxshi holatda yoki tabiiy holatda qaytarish juda ham qiyin narsa deyapti. Lekin albatta shu sabab bo'lgandan keyin, bunaqa muammo bo'lgandan keyin qo'llar katta bo'lib qolar ekan, oyoqlar katta bo'lib qolar ekan. Shu narsa uchun buni yumshoq turish uchun, ozgina harakat qilib turish uchun ikkita uchta narsa bor. Baclofen pump bor ekan, shuni operatsiya qilib umurtka bu yerda qo'yib umurtkadagi baclofen suyuqlikka ulanib qo'yar ekan, shuni qilsa bo'ladi. Yoki buni tomirni ochib turib, ozgina buni bo'sh qilish uchun harakat qilsa bo'ladi. Bu ham ozgina yordam berib turadi kasalga.
These are called functional neurosurgery to improve the function of the patient.
Buni bizda medisinskiy tilda funksional neyroxirurg jarrohini buni aytamiz deyapti. Sababi chunki bu kasalga 100% tuzash uchun harakat bermasdan ozgina qiyinchilikdan osonchilikka olib keltiradi. Yengil qilib qo'yadi.
Just like it is also called neuromodulation. Everything we think by our brain. Everything is controlled by your thinking. I want to move this and I am moving this. Impulse is passing through it. And you can modulate that thing with implanting some electrodes. That is the basis of Parkinson surgery or any movement disorder surgery. You press some electrodes in the brain, you pass some electrical impulses that change the electrical activity of the brain and the patient improves.
Chunki ko'pchilikda bu ham savol bo'lishi mumkin, Parkinson kasalini qanaqa operatsiya qilar ekan, nima qilar ekan? Shuni aytyapti, Parkinson kasali hamma narsani kontrol qiladigan miyada to'q bo'lar ekan. O'sha to'q orqali u aytar ekan, u yerda o'ylab tursiz, shu to'qni aytar ekan, mana qo'lni ishlaysiz, shu qo'lni ishlab turadi. Yo oyoqni ishlatish kerak desa, o'sha narsaga to'q beradi, ishlab turadi. Xuddi shunaqa Parkinson paytida shuning uchun oyoq qo'llar qaltirish ko'proq bo'ladi. Parkinson kasalida boshda shu to'q yaxshiroq yetib bora olmaydi. Shu sababdan operatsiya qilib miyada o'sha to'qni yaxshiroq olib keltirish uchun implant bo'ladi, miyada chip qo'yiladi, o'shanda ulanib qo'yar ekan. Keyin u to'q yaxshiroq o'tkazib turar ekan. Shu sababdan bu kontrolda turadi va normalni yursa bo'ladi.
Endi ko'pchilik uchun glavniy eng muhim narsa bu operatsiya uchun eng og'iridan eng yengildan eng oxirigacha deylik, mana shunaqa operatsiyalar uchun Parkinsonni olaylik. Mana shu kasallik uchun qancha summa ketadi hamda Hindustonda qancha muddat qolishi kerak bo'ladi o'sha uchun boshqa joydan keladi.
Sir, actually he wants to know about the DBS patient for Parkinson disease. If a patient is coming from Uzbekistan or Kyrgyzstan, so he come to India. How long he should stay in India and what is the cost of this surgery?
Yeah. So if he has been already diagnosed properly there, then we can save three days here. Then after the surgery it takes 1 day. Then post-operatively we keep him in the hospital for 2 more days. After that we start this programming, and we may have to do multiple programmings. Usually it takes 2 weeks, at least 2 weeks for 2 programming, and after that he can go home and we can program that from here also. Through internet we can program from here also, or they can program there also. So at least 2 weeks.
Parkinson kasali uchun taxminan 2 hafta uchun kelish kerak. Sababi chunki boshda kelganda 2-3 kun analizlar uchun baribir vaqt ketadi. Undan keyin operatsiya qilamiz. Keyin har kun uni apparat bo'lar ekan. Ya'ni implant qo'ygandan keyin tashqaridan apparatini ishlatib turib, uni har bitta narsani kamaytirib, ko'paytirish, nima kerak, qanaqa qilish kerak, shu narsani qilib turib, joyda qo'ygandan keyin u o'ziniki yurtiga qaytsa ham ondan keyin ham pulut bo'lar ekan. O'sha pulut orqali bu yerdan doktor o'tirib turib uni kontrol qilib tursa ham bo'ladi.
And sometimes in some cases like in dystonia it takes up to 5 to 6 months multiple programmings.
Dystonia degan kasalligi ham bo'ladi, xuddi Parkinsonga o'xshaydigan, lekin qaltirish mo'mada sal jinniga o'xshaydigan holat shunaqa bo'ladi. Unaqa kasallar uchun ham DBS operatsiya yordam beradi, lekin bunaqa kasal uchun taxminan 1 oydan 1,5 oygacha Hindustonga turish kerak.
Yana bizga shunaqa murojaatlar juda ham ko'p. Gidrosefaliya, mikrosefaliya,
Hydrocephalus, yeah.
Mana shu holatlar bo'yicha operatsiya qanaqa darajada bo'lib o'tdi? Misol uchun 100 ta bemor operatsiya bo'lgan bo'lsa, nechtasi tuzalib ketdi? Yoki bu kasallikni bo'lgan davosi
bormi? Hydrocephalus. If a patient is suffering from hydrocephalus, so if you are operated that patient, so what is your experience? What is the success rate, especially in this case?
In this case?
Yeah, in hydrocephalus case.
Hydrocephalus per se it is a very easy surgery. Okay, we have to do one hole here, one pipe there and one hole in the abdomen. Okay, it takes only 1 hour or 1 and 5 hours. But sometimes the problem is with infection and blockage. It may happen in up to 2% to 7 to 8% of cases. If the blockage or infection occurs, then we have to give him antibiotics, or sometimes we may have to readjust the shunt or get rid of the blockage.
Gidrosefaliya kasallar uchun juda ham yaxshi va juda ham oson operatsiya biz uchun deyapti. 1 soatdan 1,5 soatda bu operatsiya qilaveramiz deyapti. Bunda faqat ikkita operatsiyadan keyin muammo bo'lishi mumkin. U ham 2% dan 8% gacha ekan. Kimdirga infeksiya, xuddi shu narsa bo'lgandan keyin infeksiya bo'lishi mumkin. Agar infeksiya bo'lsa, antibiotik berishingiz kerak. Beramiz va bundan keyin yana bitta narsa bor ekan. Kimdirga qo'ygan shunt ishlab chiqaradigan suvni ishlab chiqaradigan shunt yana bukilib qolsa, o'sha paytga ham uni ochish kerak, operatsiya qilib uni ochish kerak. Bu narsa 2% dan 8% gacha. Ya'ni 100 ta kasalda operatsiya qilsa 92 ta kasalda muammo bo'lmasligi kerak. Buni qolib 2 kasaldan 8 ta kasalga bunaqa narsa bo'lishi mumkin.
And nowadays we put programmable shunt.
Keyin bugun yangiliklar bor ekan. Bu kunlarda oddiy stent emas, standard stent emas, programmable stent bor ekan. Ya'ni uni stent qo'ygandan keyin u stent qo'ygandan keyin miyani tashqaridan uni o'zgartirib tursa bo'lar ekan.
Yeah, you can control it through magnet from outside.
Magnetdan o'sha orqali uni ulantirib, o'zgartirib tursa bo'ladi. Uni miyani ochish shart emas. Ya'ni bir marta qilsadan davosi bor ekan.
And in some cases we can put it through neuro navigation. So the exact location we know where we had to go.
Yangi texnologiya bor ekan, neuro navigation deymiz biz. Shu texnologiya bo'yicha ham aniq o'sha joyda hech qanaqa farq bo'lmasligi kerak. Shunaqa operatsiyada o'sha joyga borib, u o'zi apparat o'sha narsani joyiga shantini o'sha joyiga qilib qo'yar ekan.
O'zi avtomatik tarzda. Keyin bizda shunaqa murojaatlar ham bor. Asosan endi men xalq tilida gapiryapman. Miya yemirilishi tashxisi qo'yilgan. Mana shunaqa kasalliklar bor. Bizga 3-4 ta murojaat tushgan. Endi miya operatsiyasi bo'yicha deganingiz uchun mana shunaqa kasalliklarni davolash mumkin.
Sir, actually we have one patients who have brain problem, especially not in the brain area, but he have problem in the skull. So yeah, okay. So bone related problem. So for this type of patient, is there any treatment?
Yes, in the bone there may be many things. It may be tumor, it may be benign tumor, non-cancerous, or it may be a cancerous tumor, or there are some malignancies in the body which spreads to the skull, like prostate cancer, lung cancer, or there are some blood malignancy also, which may go to the skull. For that we have to take a biopsy or do a operation, send the biopsy, then decide whatever has to do next.
Bunaqa kasallar uchun ko'pchilik bunaqa holatda sabab ko'proq bo'lishi mumkin deyapti. Kimdirga o'pkada anglagis narsa bo'lsa ham miyada emirish shunaqa narsa bo'ladi. Kimdirga qonda muammo bo'lsa, anglagis narsa bo'lsa miyada emirish bo'lishi mumkin. Kimdirga osimta bo'lsa ham shunaqa narsa bo'ladi. Shuning uchun o'sha narsani olib bizga biopsiya qilib, ya'ni uni olib ekib tekshirishimiz kerak deyapti. U nima sababdan bo'lgan ekan? Agar shu narsa biz bilsak, keyin uni davolansa bo'ladi.
Davolasa bo'ladi. Shunaqa holatlar bo'lgan.
Ha.
We have operated before 10 to 12 days.
Bu Parkinson kasal ekan. Taxminan 10 kun, 15 kun oldin buni operatsiya qilgan ekan. Bu operatsiya oldingi holat.
There's a movement. Okay.
Oldingi holat.
This is before your operation.
Bu operatsiyadan oldin.
You can see the movement. Okay.
Oyoqlar, qo'llar qanaqa
See the movement.
tezroq qaltirib turibdi ekan.
You can see the movement. This is before operation.
Operatsiyadan oldin.
Okay. This is after operation. You can see.
Operatsiyadan keyin.
Yes.
Operatsiyadan keyin bu. Salomlashyapti, qo'llar beryapti, hamma narsa o'zini ko'taryapti.
There is no tremor.
Hech qanaqa qaltirish yo'q.
Okay. Here first we do a CT scan. We do a CT scan.
Computer tomography.
Computer tomography. I am telling you the procedure.
Qanaqa buni
First we do
diagnose
a CT scan of the brain
birinchi computer tomography qilamiz.
after fixing a fixator. Then we do a MRI. Then we fuse the images of the CT scan with the MRI.
Keyin MRT qilamiz. Ikkalasi narsani ham computer tomografiya ham MRT yaniki keyin nima farq bor ekan ikkalasida ko'rib turamiz.
And then we take a target.
Keyin aniq qayerda qo'yishimiz kerak implant.
Where to put the implant.
Kerak.
Then we put this. This is the stereotaxy frame. So that we have to
stereotaxy frame degan narsani chunki Parkinson kasalidan keyin bosh miya ham qaltirib turar ekan, aniq o'sha joyiga qo'yilmasa chunki millimetr farq kelarsa natija yaxshi bo'lmaydi. O'sha joyda qo'yish uchun bu narsa boshni umuman kemirlamas uchun buni qo'yib turar ekan operatsiyaxonada.
Fixation, then the stereotactic frame. Then when we put the implant, we know with these waves that it's on the right
implant
part.
qo'yadigan paytda kompyuterdan shunaqa ulanib turar ekan toklar bilan tepada
This changes.
misol uchun nima kelyapti ekan har bitta narsa buni ekranda ko'rsatib turar ekan. Qanaqa o'zgaryapti bu narsalar.
This is different. This is
o'zgaryapti.
different. We can see it. Then this is the battery.
Bu batarka ekan.
We put it here in the
Bu
chest.
yerda.
And
O'qini tepada qo'yar ekan bu yerda.
one lead inside the brain. Here inside the brain, we take
Keyin bu
it like this.
miyadagi tok bilan shuni ulanib qo'yar ekan.
See, we put one here, one there.
Bu
Small
mushakni
cut.
ichida bo'ladi, kichkina maydasi kesar ekan.
This is the
O'shani
ear.
ichida.
Behind the ear, we take it up to the. This is the chest. We put it in the chest.
Ko'krak
Okay.
qafasi tomonidan.
And we can program it with a mobile, with a device.
Mana bu apparat bor ekan, telefonga o'xshaydigan. Xuddi shu apparat orqali buni har bitta narsa qilib tursangiz bo'ladi. Kontrol qilib tursangiz bo'ladi. Mana bundan
Everything
kontrol
is
qilib
control.
turyapti ekan. Qancha tok borish kerak, miqdorini, soni har bitta narsa bundan kontrol qilib
Hozir
turgan.
buni yagona yo'li mana shu narsani qo'yish, implantni qo'yish. Bu siz davolash iloji yo'q kasallikka.
Parkinsongami? So actually, he wants to know that is there any other treatment
Where
without
Parkinson?
without
One is medication. Now, first is medication, always medication. Different types of medication. Okay.
eng birinchi dori darmonlar. Agar undan foyda bermasa keyin
And all Parkinson is not a candidate for DBS. There is some selection.
keyin eng asosiy narsani Parkinson kasaliga operatsiya qilish uchun o'sha kasalni tanlash eng muhim narsa deyapti. O'sha qaysi kasalga bu operatsiya foyda beragan shu eng muhim narsa.
And these are the leads. It's very small leads. You can see in millimeters. These are the leads.
Millimeter buni o'lchash millimetrda bo'lar ekan.
These are leads.
O'sha qo'yadigan narsasi
Qo'yadi, miyada qo'yadigan narsa.
Yeah. These are the leads. You can say. These are inside the brain. Inside the brain. You can put multiple leads. In this case, we put two leads. One right, one left.
Sizlar ko'ryapsiz qanaqa meditsina rivojlanib
And this is the post op.
Miyaga nimalar qo'yilyapti.
Bu operatsiyadan keyingisi
This is the leads inside the brain.
miyani ichida qo'ygandan keyin.
Okay.
Eng muhimi kelgan odam umidsiz bo'lib qaytmas ekan. Aka,
Albatta, xudo xohlasa.
sehrli qo'llar deyiladi. Doktor, bunaqa ishlardan charchamang, ko'pchilikka hojatini chiqarishda davom eting, ko'pchilikka xursand qilishda davom eting. Xudo xolasa biz ham o'sha Hindiston meditsina bo'yicha yetakli o'rinlarda bo'lgani uchun biz ham mana bemorlarni jo'natyapmiz. Ko'pchiligi, juda ham ko'pchiligi xursand bo'lib oilasini bag'riga tuzalib qaytib boryapti. Hozir mana bu joyda ham ko'ryapmiz qanaqa yangi texnologiyalar bu. To'g'risi tilojiz, xudo xolasa bemalol.
Menga o'zingiz ham hayron bo'lib qoldingiz.
Shunaqa aka. Bemalol jo'natamiz xudo xolasa. Sizga kattakon rahmat.
He got shocked sir when he seen this thing. So that
Okay. It is
type of medical.
I tell him these patients' lives are miserable. Can you imagine every time like doing like this every 24 hours?
Aslında kancha keyin deyapti. Misol uchun 24 soat qo'l oyoqlar qaltirib turyapti, bosh qaltirib turyapti. Hech qanaqa narsa ushlasam bo'lmaydi. Hattoki suv ushlab tura ichaman desam ham kelolmaydi ichari. Qaltirib tursa qancha keyin u kasal uchun o'sha holatni o'ylab ko'ring. Keyin bunaqa holat bo'lgandan keyin u kasal uchun qancha xursand bo'lib ketadi.
It is magic. You do it, patient.
Mana shu qanchaga tushadi mana shu implant qo'yish? Misol uchun eng og'ir deb oladigan bo'lsak.
So what is the last price for this type of surgery specific for DBS?
DBS. It depends. We are doing it in a very low cost setup. If you compare from other hospitals, we are doing because we are with medical people. We are working with them since many years, and our motto is humanization of healthcare. It is not only profit, humanization, compassion, passion, and benefit to the society in a ethical way. So we charge it minimum. And if the patient is poor, with our corporate social responsibility and with the help of them, and we do it in a reasonable way. There is no problem about the cost.
So is there any fix?
There is fixed means you can say under in a, this
like from to up to.
It varies from if I say in dollars, suppose 18,000 to up to 32,000.
Bu operatsiyaga birinchi etapda bu больницаga yoki doktorga foyda bo'lsin deb kelmaymiz. Sotsial odamlar, ya'ni xalq, oddiy xalqiga bizning bu operatsiyadan ularga hayotiga olib kelish uchun qancha foyda ko'proq bersa, agar kambag'al kasal bo'lsa, xudo xolasa eng minimalni narxlar berib bu operatsiya uchun harakat qilamiz. Misol uchun pul odam bo'lsa ham, bo'lmasa ham yordam berish uchun harakat qilamiz va buni narxini $18,000 dan $32,000 atroflarida bo'lar ekan.
Cost is a issue in this type of surgery, but with the coming of new companies, the cost is gradually decreasing.
Balki kelajakda ko'proq shunaqa apparat ishlab chiqaradigan firmalar ko'paysa, konkurent ko'proq bo'lsa, sekin-sekin yana ham paketlar ham tushishi mumkin.
But if you compare the amount of medicines he has to take for next suppose 10 years, then it is almost comparable.
Aytibdi Parkinson kasal har kun dori ichadi. Agar har kun dori ichish uchun 10 yilninki dorini hisoblab turing deyapti. Bir yilda qancha dori uchun pul sarflagan, 10 yildan hisoblab tursangiz, u qimmatroq bo'ladi, bu operatsiya arzon bo'ladi.
And the patient with this tremor, he cannot do any work.
Keyin har doim dori ichsa, ichmasa qaldirib turar ekan. Lekin bu operatsiyada dori narx agar ikkalasi solishtirib ko'rsangiz, bu arzon tushadi, dori narxi qimmat bo'ladi.
Then at least he can do some work, he can earn some money.
Operatsiyadan keyin o'ziniki ishlar ham qilsa bo'ladi.
Bemor ishlab ketsa ham bo'ladi.
Yeah.
Do'stlar, mana qo'ldan kelguncha mana shu miya hamda umurtqa kasalliklari bo'yicha qo'ldan kelguncha o'sha savollarni berishga harakat qildim. O'ylaymanki, ko'pchilik bu videodan xudo xolasa javob oladi inshaalloh. Mana shu videoni yana boshqa odamlarga tarqatib yuborsanglar, ular uchun
juda ham chuqur ma'lumot berdi bizga o'zi hozir.
Juda ham muhim ma'lumotlar.
Juda muhim.
Hatto men bilmaydigan ma'lumotlar bor ekan, shuning uchun tarqatib boshqalarga aniq qilsangiz, xudo xolasa manfaatli bo'ladi. Doktor, sizga kattakon rahmat. Inshaalloh mana shunaqa bemorlarni chiqaramiz. Mavodi tuzalib qaytsa, yana bitta video qilamiz inshaalloh. Tuzalgan holatda birgalikda.
Inshaalloh.
Inshallah, thank you. Just wanted to add another thing. I have seen many children patients also there with some spasticity problems. So we are starting this spasticity surgery also for child. Tendon transfer, some leg are like this. They cannot walk.
Kichkina bolalarga O'zbekistonda borganmiz, konsultatsiyada ko'rganmiz deyapti. Oyoq qo'llar shunaqa holatda, misol qat'iy bo'lib turar ekan, shunaqa kasallarga tendon transfer degan narsa operatsiya bor ekan, ya'ni bironta tomirni olib boshqa joyga qo'yar ekan. O'shandan u yumshoq bo'ladi, keyin qo'l ishlash mumkin.
In cerebral palsy patients, so
cerebral palsy,
so that their quality of life improves.
Ya'ni normal hayotga qaytarsa bo'ladi ularga.
Aka, keling o'sha xalqimizga osonroq bo'lishi uchun Telegram raqam bersangiz, xudo xolasa, mana shu yerga yozib qo'yaman ekranga. Bemalol mana shu kasallik qog'ozlarini siz bilan maslahatlashsa, bo'laveradi, xudo xolasa.
Albatta, xudo xolasa.
Nomer yozib qo'yaman do'stlar, xudo xolasa qanaqa savollar bo'lsa, mana shu operatsiya bo'yicha, kasallik bo'yicha mana shu nomerga Telegramda yozib yuborsanglar, qo'ldan kelguncha javob berishadi. Lekin operatsiya bo'lishib bo'lmasligi, keyin rezultat hammasi bu yoqqa kelib, bu yoqdan analiza topshirgandan keyin o'shanga qarab operatsiya narxi aytilishi mumkin.
Albatta, shunaqa bo'ladi. Chunki har bitta diagnozniki narx boshqa bo'lishi mumkin, har xil bo'lishi mumkin. Chunki bitta kasal bor, misol uchun Parkinson kasal, bitta bor Parkinson bor, qo'shimcha muammo bo'lishi mumkin. Shuning uchun har bitta narsani operatsiyadan oldin albatta hamma narsani tushuntirib keyin har operatsiyaga oladi.
Yoki boshqa joylarda jiddiy kasallik deb o'ylangan narsa bu joyda oddiy bo'lib chiqishi mumkin. Arzon bo'lishi mumkin. Bo'ldi, rahmat.
Thank you.
Rahmat sizga.